because 1 out of 3 of you will turn queer. And if we catch you involved with a homosexual, your parents are going to know about it first, and you will be caught. Don't think you won't be caught, because this is one thing you cannot get away with. This is one thing that if you don't get caught by us, you'll be caught by yourself. And the rest of your life will be a living hell.
Welcome to Psych IRL. The attitudes of sexuality and its acceptance have fluctuated over time. In ancient Greece, homosexual relationships weren't as frowned upon as they were in the United States, say in the 50s. The phrase's meaning today may not even embody how the ancient Greeks thought of their relationships. The sacred band of Thebes, for example, were said to have been composed by same-sex male couples. It was theorized this would strengthen their protectiveness for one another, since the army was made up of lovers. In the beginning of the 12th century, hostility toward homosexuality began to grow in parts of Europe. Some sources have linked it to the growth of Christianity, but others have claimed it to start further back. Christianity's main approach was procreation. The more babies a Christian couple had, the faster Christianity would spread, because the couple would teach their kids, and their kids would teach their kids, and so on. Homosexual relationships stood in the way of this goal, and were therefore looked down upon. Other non-procreative sexual acts were also looked down upon, such as masturbation, oral sex, etc. Soon religious views began to be implemented into societal law. In the 13th century, males found to be partaking in homosexual behaviors were punished by castration or burning. In the 1900s, many sought out treatment for friends, children, and family members for homosexuality, but psychiatry and medicine didn't universally see it as a mental illness. Prominent psychoanalyst Sigmund Freud wrote a letter to a mother who sought treatment for her gay son. Homosexuality is assuredly no advantage, but it is nothing to be ashamed of. No vice, no degradation. It cannot be classified as an illness. We consider it to be a variation of the sexual functions produced by a certain arrest of sexual development. Unfortunately, this view would soon change in the 1940s after Freud's death. Other psychoanalysts, such as Sandor Rado, criticized Freud's views. He deemed homosexuality as unnatural and ultimately going against nature. Other psychoanalysts began to follow, such as Irving Beiber in 1962, who believed the cause was from a distant father and overbearing mother. These new theories introduced a number of gay conversion therapies, in which the goal was to reduce homosexual behavior and increase heterosexual behavior. Homosexuals could be involuntarily committed to psychiatric facilities by their families. They were subject to a number of practices, such as castration, aversion therapy. This included taking nausea-inducing drugs while watching same-sex erotica, so they could associate nausea with same-sex desires, or electroshock while watching the erotica, associating pain with same-sex desires. Other practices included lobotomies, where a pick-like instrument was inserted through the eye socket and into the brain. Patients were often left severely disabled. Now, all while this was happening, there was a growing amount of research that countered the theory of homosexuality as a pathology. Researchers found homosexual behavior occurring naturally in a percentage of animals. Also, the research used for the support of conversion therapy concluded homosexuals to have greater psychological disturbances compared to heterosexuals. A problem with those studies were the biases in the population. The participants recruited for those studies were from prison. Evelyn Hooker found no difference in psychological disturbances between straight and gay men when her study sampled men that weren't in prison. In 1973, homosexuality was removed from the DSM and replaced by something called ego-dystonic homosexuality. Its criteria involved: number 1, persistent lack of heterosexual arousal, which the patient experienced as interfering with initiation of maintenance of wanted heterosexual relationships. Number 2, persistent distress from a sustained pattern of unwanted homosexual arousal. Activists called for more action, saying this move from the APA was done to compromise for psychologists who made a livelihood from gay conversion therapy. In 1987, it was completely removed from the DSM. This resulted in a split from the psychological community. Many groups who advocated for keeping homosexuality as a mental disorder split and formed small groups such as Narth, Exodus, and Jonah, continuing conversion therapy. The years following led to many legal battles and some of these organizations shutting down. In Michael Ferguson versus Jonah, the New Jersey Civil Court was sued for deceptive practices. Some patients claimed the therapy not to work, reporting they were still attracted to the same sex. They also had to pay for mainstream therapy for the damages done in conversion therapy. therapy. Conservative groups in Welch versus Brown, ban of therapy in California, fought against the ban of conversion therapy, saying that it is a violation of free speech, freedom of religion, and privacy. Today, the law bans conversion therapy for minors in 5 states: California, Oregon, Illinois, Vermont, New Jersey, and DC. 45 states have no laws on conversion therapy.